Hey, what's up, everyone? Okay, I think we're live now. Hey, what's up, everyone? It's Dr. David here from El Paso Manual Physical Therapy. We are doing a live stream to answer a comment from one of our videos earlier that we released in the past. And today's question is, what can I do to stop the swelling in my right knee? This was asked from Tanica Maynard, Tanica Maynard. I'm sorry if I mispronounced your name. And I get asked this question all the time in relation to so many different knee problems. How do I reduce the knee swelling? And the good news is it's kind of the same process for several different knee problems, whether it's knee arthritis, knee meniscus problems, a knee injury like a knee sprain. If you've had like an ACL ligament sprain or MCL ligament sprain, swelling will occur in the knee, and that's part of the normal healing response that is supposed to happen so that all the blood flow and all the fluid can come to the area that's injured and bring the healing substances, the healing cells to the body so they can do their work and begin the healing process. But what I find a lot of people, the place you're coming from when they ask is they're getting recurring swelling. So it keeps happening because I think for most people, if you get an injury, you're expecting a little bit of swelling, especially if it's your joint. You might have some swelling associated with that. But if it's been a while and there hasn't been like a recent injury, like you didn't just twist your knee or somebody didn't just fall into you, you didn't have a sports accident just recently, then you are likely going to have this recurring knee problem. I just want to check that everybody can hear me. It's looking good on my end. I see that there's a few people live with me. Could somebody just type in the chat and say hello if you can hear me? I'll keep going anyway. Um, so going back to the knee swelling, if your knee is swelling, it's a sign that you're putting too much pressure in the area. If it's happening in a chronic fashion, like if you've been having knee swelling again and again, like over the course of weeks, months, or even years, especially like with arthritis, it means you're putting too much pressure on your knees. There we go. We've got some comments coming in. Hi, Maria. Hi, Jane from Portugal. Wonderful. Obrigado for being here. Um, anyways, if you have a ligament problem, like you're dealing with an MCL or an LCL problem, then you're overstraining those ligaments. You're pulling them too much. You need stability. Any way you slice it, you're putting too much pressure, too much stress through the tissues in there, and they need to be relieved of that stress. So the best place to start is first to figure out what is your injury? How are you getting the swelling? So let me get my skeleton here. All right. I'm so sore. So I'm grunting and groaning as I move. In your knee joint here, you've got the meniscus in the middle of the knee joint, you've got ligaments all around, and then you've got cartilage on the ends of the bones. The way that you can tell which tissue swelling is based on where you're getting your swelling. If your swelling's primarily in the front of the knee, you likely have a tendonitis type of problem. That needs to be just rested. There isn't much you can do as far as bracing, adding any sort of a compression. I mean, you can put a sleeve on. It might help you, but it's not really going to make the swelling go away. You need to rest it. For a meniscus problem, the tissue that's inside right here, that big thick cartilage that's between the thigh bone and the shin bone, you need to get off of it. You need to stop getting on your feet as much, reduce it to the minimum possible that you can do for the day. So just for what you need to get around, like to make a meal, go to the bathroom, take care of yourself, your daily chores. Of course, if you work, then whatever you got to do for work. But I would look to sit down when you can, drive when you can, get a ride whenever you can, and avoid walking for exercise. You can still exercise, but I would avoid doing stuff where you're weight bearing if you've got a meniscus problem. And the same goes for an arthritis problem. A knee arthritis problem is cartilage lining right here. If you're putting pressure through it and you're using your knee joint, your kneecaps moving, and your thigh bones moving right here, then you're also going to be putting too much pressure on it. You need to get off of it and make sure that you offload the tissues and allow that swelling to go down. Whenever a knee problem flares up, swelling is associated with it, and you cannot work on strength. You can't stay active. There's just so many things that you're limited by if you don't get that swelling that swelling under control. It is vitally important that you get that swelling down under control. Now, that's my number one recommendation is get off your feet, get off your knee, avoid putting pressure through your knee, avoid using your leg kind of. And I just said that comment, avoid using your leg, but put it in the context of what I said earlier. You still have to take care of yourself to do your daily activities and all that. Now, some tips that I can give you that might help to reduce the pain, even, or I'm sorry, the swelling and the pain really, is using a wrap, something like this. We're just doing videos talking about this today, and wrapping this around your knee joint. I'll show you real quick how to do this. And it helps with swelling in the short term, but if you're still on your leg too much, it's going to swell again. But this might help you avoid taking pain medication. So you put your legs straight, just like so. Put this on top, and ideally right on top of your skin. However you can do this, so because it's going to be tight. And you would just wrap it around. So I don't have any shorts on today, so you're getting it over the jeans, and ideally smooth it out. And I would put this on for a few hours, see how long you can tolerate. Just make sure it's not cutting off your circulation. It's going to limit how much you move, but it adds compression enough to begin to get that fluid out of the knee. So you can still walk around in this. See, I can still bend and move my knee, but it is tight. I can't walk as good with this on versus with it off. So this is one option for you. Of course, you can buy like one of those neoprene sleeves, the ones that have a little hole in it. Sometimes they have a hole, sometimes they don't. But that also adds compression. Sometimes those are a little bit difficult to get on, and depending on the shape and size of your leg, that may not work. And a little ace wrap like this might work better for you in case you have trouble with braces. So a real simple ace wrap like this works very well. It has these clips right here that have metal hooks on them that hook to the fabric. Elevating your leg is another potential option. And when you elevate, this is a big deal because a lot of people think, oh, I just have to put it up on a chair. Like you can be sitting down, and let me show you my leg here. Like you can just do that and they count that as elevation, but really it needs to be elevated in relation to your heart. So you need to go lie down and probably get your legs as high as a chair like this so that you can get enough elevation to get the benefit of it. So it'd be more like this. My heart's right here, knees up there. So now the fluid can drain down, and you got to be like this for a while. It's not enough to lay like this for 15, 20 minutes. In my opinion, if you can be here at least 40 to an hour or more, that's best. If you can, work from this position or maybe watch TV or watch YouTube from this position, that would be best for you so that you can get the most effect in reduction of swelling for your knee problem. Now, anti-inflammatory medications could be an option. You got to worry about those though, because they do have a lot of side effects. The stuff that I'm showing you is natural. They tear up your stomach specifically. There's known research studies that show that NSAIDs, especially like ibuprofen, naproxen is another one. Those types of medications are known to irritate your stomach lining. It can cause bleeding in the stomach and in the intestines. So you just got to be careful with that. And it's usually safe if you use it for a couple of weeks, but if you're using it for weeks and weeks and weeks on end because you're dealing with chronic swelling, not a good idea. I've seen people that have been hospitalized and even died because of excessive use of ibuprofen. But if you're using it, just here and there a few times, not consistent, and it's not, over consistently over a period of time, like 2 months, then you should be okay. And another option is talk to your doctor if you feel like you need more help with swelling problems, like especially if you have heart issues, if you have cardiovascular disease, congestive heart failure, CHF, that could be contributing to the swelling in your knee. You'll probably have swelling in both legs, and it can cause knee pain because of the extra fluid that's in your knee. It just doesn't let your knee move well, and it can be painful. But it may not be that you have a knee problem. It's really a heart issue, and that needs to be addressed and managed properly. It was one other thing I needed to tell you guys about swelling regarding, oh yes, exercise. Huge deal. If you exercise, light exercise, like using a bike, I've mentioned tailgate swings on here plenty of times. If you have swelling in your knee, you just do this. That gets the fluid moving inside your leg. This is probably the easiest thing to do. No equipment needed. Just find somewhere you can sit where your feet dangle. And even if your feet touch the floor, just slide your feet on the floor back and forth. And do this for 5, 10, 20 minutes if you want, just to get some fluid moving through your leg. That can help to reduce the swelling in your leg on a minor scale, in combination with the elevation, with using compression and making sure you stay off, not putting pressure through your joint. That should allow you to reduce it down. And then using a bike for exercise where you're not putting a lot of resistance through it, but moving consistently. Doesn't have to be fast at all. You need to have enough motion because you have to bend your knee on the upstroke of the bike. Your knee has to come up quite a bit. So if you have mobility problems on top of the swelling, then it could potentially be troublesome. But I would avoid anything weight bearing like an elliptical machine, definitely walking if you're dealing with knee swelling. And I wouldn't come back to weight bearing exercise until that swelling is under control and you can trust your leg to not swell again right away. You might have to manage how much time you're on your feet once you come back to it. Like if you can only tolerate 5 or 10 minutes, cut it short. Don't make yourself swell again because then you're working backwards. All right, I'm almost done here. I have just a few minutes. I have something from Monica Starr here. I'm going to the comments. Best tip: if I have a medial meniscus tear, not sure yet, cried that I can't cross my legs significantly, have affected leg. I know if you have a knee problem like that, like a meniscus tear, you can lose motion sometimes, and it's not comfortable to cross your legs like you used to. Mobility work is the number one thing I could think of. We put videos out on how to bend the knee, just to review how you would do that. So if you can bend your knee like this and it's not hurting you to do so, you just feel tight and stretchy, then you can stretch in this position. But if you get pain or it just locks and doesn't want to go, I would not force more bending in this position. And then the other thing, depending on how you cross your legs, if you cross your legs like this, it might be more tolerable. But if you like to cross your legs more like this, where your thighs are closer to each other, that could set off the knee pressure. And then the other one that people do is they sit like this with their leg under. That means you have to bend your knee all the way. You could be dealing with a tibial shift, which we've talked about in the videos as well, in which case you'll have to shove your knee, the bottom part of your knee, outwards this way, like that, to get it to settle, and that might increase the motion. You also have to follow up with an exercise where you bend your knee and turn your foot inwards as you bend your knee. That helps out tremendously to gain more motion back, Monica. Link that video in the description later on today after this video is over, because that's a tremendous, I know it's been a tremendous help to a lot of people. We've had a lot of people comment on that video. And I mean, it's techniques and exercises that we use here in the clinic with our patients that have a great effect as well. So almost going to start wrapping up. If anybody has any questions, ask them now. So special thanks to Tanica Maynard for asking the question, what can I do to stop the swelling in my right knee? Just to review, the number one thing is get off your knee. If you didn't get hurt recently, this is a chronic thing. You've got to get off your knee. It's the same as if you had a cut on your hand right here and you're letting it heal, and you ask yourself, well, what do I do to let it heal? Stop grabbing stuff that aggravates the wound, the scar, or the scab. You've got to let that scab go through its healing process. Same thing inside your knee joint. The trouble is, if you've got like a muscle imbalance or some massive tear, some massive arthritis, then there's a whole other process. It's not just as simple as waiting and letting it heal. You've got to be more active in the recovery of it, but you've got to wait till it calms down in order to tolerate the exercises most of the time. So I hope that helps out, Tanica, and everybody else out there listening. Please comment on here with more questions. I'll be looking through the comments as time goes on, and we'll be thinking of more great topics to bring up on these live streams. We get a lot of questions about knee problems, but I'm open to answering questions for back problems, neck, shoulder, elbow, wrist, hand, ankle, foot. We're pretty good at handling the whole body, and we have lots of great information for you all, and hope to bring it to you in a fun form as possible. All right, guys, I got to get going here. Have a wonderful day, and thanks for joining me on this video. Bye-bye.